throughout the nation during the primary season. Last year, over 10,000 children in South Carolina were reported abused and neglected. What's your plan for keeping children safe in their homes, in their communities, and in the schools?
Well, look, can I say first what a lot of people in this audience won't know, which is what a great organization you're associated with. I actually did a forum with your organization. I think it was in Iowa, if I remember correctly. Was it in Iowa? And you've done forums with presidential candidates all over the country, and raising all of these issues having to do with children, and you should be very proud of what you're doing. I think you have to start first, if you're looking at it in a bigger picture way, not just in a small way, you have to start with the systemic causes of abuse. And the systemic causes are people who don't have a job, who live in poverty, who have drug and alcohol problems, who are in and out of jail and in and out of prison. And so what that means is you got to have a comprehensive plan to end poverty in America. You're looking at the candidate who has that comprehensive plan. It's a huge issue in my own life. I won't go through everything I would do. I'll just mention a couple things. I mentioned universal health care. We should raise the national minimum wage to $9.50 an hour. It should be indexed to go up on its own. We should have a national predatory payday lending law so we don't take away what little bit people have. Make it easier for kids to go to college. If they're willing to work there, pay their tuition and books. I mean, I've got a bunch of other ideas, but first, deal with the systemic problem of poverty. We've got to bring jobs into low-income areas so that families can actually support and sustain themselves. What we know from all the studies that have been done is when people are under extraordinary economic stress, it creates an environment where abuse is sometimes rampant. So we got to get jobs into these communities, trade policy, tax policy, incentives to bring jobs into these communities. Drug and alcohol problems. One of the reasons we need a universal health care system that covers all of that, drug and alcohol counseling and rehabilitation, is to ensure there's an infrastructure that when these problems show themselves, either internally within a family or externally to authorities or police officers, that they can identify people who have a drug and alcohol problem and get them the help they need. And that same thing applies, by the way, to young people or older people who have a brush with the law, many times driven by a drug or alcohol problem. Instead of doing what we do today, which is we lock them up, and when they come out of jail or prison, we send them right back to the environment that got them in trouble to begin with no help at all. We can't build enough prisons in America to solve this problem. We ultimately are going to have a way to try to turn their lives around. And so that means drug and alcohol treatment, rehabilitation, it means job training, it means education, additional education if they need additional education. I mean, all these things are the tools. And then ultimately, we need to do everything in our power to support when we identify a child who's in an abuse situation where they're at risk. We have to take action and take action immediately. I mean, we need to deal with the systemic problems. We need to deal with their family, but we got to make sure immediately that those children are in a safe environment. So it's doing all those things, I think, in combination.
I can talk loud. My name is Sarah Brown, and I'm a student here at USC at the School of Public Health. And as you can see, I think that healthcare matters, and I've heard a lot about your plan. But can you explain to me, just as a young voter, how your plan is different than Hillary Clinton's and Barack Obama's, uniquely different?
Yeah, I'd be glad to. Well, I'd say so. I think a couple things before I even get to the substance. I think it shows how important you think healthcare is, how quickly you came out and led on this issue. All of us have been in this race for over a year now. I came out almost a year ago in February with a comprehensive universal health care plan. It was the single biggest issue domestically in my campaign. So I knew how important it was. I didn't wait. Senator Obama, to his credit, came out with a plan a few months later. Senator Clinton came out with a plan a number of months later. Now, the differences in our plans are well, let's start with basics. I believe that every man, woman, and child in this country is worthy of health care. I think the threshold question is the plan universal? From my perspective, if it's not universal, it doesn't meet the test. Senator Obama's plan is not universal. I don't think he even argues it's universal. My plan and Senator Clinton's plan are both universal. For it to be universal, it has to have a legal requirement. In other words, if you don't have a law that says everybody has to be covered, then it's not, you're going to leave, I think the estimates are as many as 15 million people out. So the biggest differences are between my plan and Senator Clinton's and Senator Obama's. His plan's not universal. Ours, both of our plans are universal because it has a legal requirement. The other differences are more subtle. And this applies between my plan and both of their plans. Medicare is intensely sick financially. Everybody's worried. Medicare, healthcare for seniors, is under intense financial stress. We're going to have real problems in about a decade or less unless we do something. So all three of us have serious savings in Medicare. We do something about drug company ads. We use the power of the government to negotiate better prices for prescription drugs. We have one person who's responsible for coordinating care for chronic care patients. Those are some of the ideas. They're very similar. Here's the difference. The difference is all the savings that we create, I keep in Medicare. I don't take them out of Medicare because I think it's important. And it allows us, by the way, for the seniors who are here, to close the donut hole that exists with our prescription drug coverage for seniors right now. Both of them take their savings out of Medicare and put them someplace else. And the reason they have to do that is because they pay for their plan. I'm getting a little in the weeds, so bear with me. They pay for their plan by rolling back Bush's tax cuts for people who make over $250,000 a year. I roll back the tax cuts for people who make over $200,000 a year. So there's a $50,000 gap there. I go down to 200, they only go to 250. They have to make up that difference somewhere. And so the savings in Medicare is how they make up the difference. They pull that money out of Medicare and put it someplace else. I just think that's not a good thing to do. I think it makes more sense to go down to 200,000, keep the savings in Medicare because Medicare is so much at risk right now. Those are the biggest differences. And then I get one last thing I just want to mention. This is not substance, but it's how we would get it done. All of us have a very different approach to this issue. I mean, it is really different. This is actually, I think, the biggest difference between the three of us. I mentioned earlier I've never taken money from a Washington lobbyist or a special interest PAC. Because I think if you're going to take on drug companies, and insurance companies, and lobbyists, you have to have some independence from those people to be able to do it. One of the things that's really unusual about this particular presidential campaign is the presidential candidate who's raised the most from drug companies is not a Republican, it's a Democrat. And the one who's raised the most from insurance companies is not a Republican, it's a Democrat. And it's the two of them. It's not me. And I bring that, there's nothing illegal or unethical about what they're doing, just to be clear about this. But what I believe is it's very hard to take those people on and challenge them if you've taken so much money from them. I think you have to have enough independence from them to be able to take them on.